Okay, we are live and we are going to be talking about who is the ideal candidate for a hair transplant. Now, we have something that's really exciting in 2025, which is this year. We're giving away right now, we're giving away not one, but 2 free hair transplants. So this is really exciting. And we're looking for an ideal candidate who is male. And we're also looking for an ideal candidate who is female. And we're going to talk about who that ideal candidate is in this live session today. We're going to be talking about the criteria that we undergo to make the proper analysis for who is the ideal candidate for a hair transplant. But during this video, at any point, ask us questions, okay? The more questions you ask us, the more questions we'll answer, and you're going to get a lot
of more insight they get.
And the more insight you're going to get. So this is live right now, but we're gonna post this so that it's going to live on YouTube, and we really want this to be a go-to video for you to really understand whether you're a candidate for a hair transplant.
Okay. So how do we start?
How do we start?
When a patient comes in who is requesting a hair transplant, what are the steps that we normally take?
Okay, so first and foremost, we have to understand what you're trying to achieve, okay? And we have to have realistic goals in mind, okay? If you're coming in and you have pretty significant hair loss and you think you're going to cover the entire area, that should not be your goal. There has to be certain things, certain incremental goals you have to strive for. And by the way, I should emphasize that sometimes someone has to go for more than one hair transplant. So don't think you can achieve full coverage on a one go.
Yeah.
Okay.
So
what do we look for when someone comes in?
Well, first of all, let's back up a little bit, because I really think we have to take, when we see a patient who is considering a hair transplant, we get first a thorough medical history. We want to get a good family history, because you want to know how common balding is in that individual, if their father or their grandfather, either on the male side or the female side, because it's polygenetic.
That means either your mother can be contributing to your hair loss, or your father can be contributing to your hair loss.
Right. And sometimes we do blood tests to evaluate certain blood levels on an individual. Sometimes people have low thyroid hormones, or they
PCOS is another condition that can be contributing to hair loss.
Right. So there's many things that we have to investigate, and occasionally we even do genetic testing to evaluate their medical background. After we've established that there is no medical reasons why they have hair loss, then we actually do the physical exam. And the physical exam involves
doing a trichoscopy test,
which is
this fine microscope that allows us to see down to the follicular level where the follicles come out of the scalp. And what it allows us to appreciate is whether you have potentially androgenetic alopecia, which is the most common form of hair loss, or you might have a scarring alopecia.
Okay, so tell us what androgenetic alopecia.
Androgenetic alopecia commonly is caused by your genetics, sometimes hormonal changes, and then a big contributor is DHT, dihydrotestosterone, which is a hormone that causes miniaturization of hair follicles.
Okay,
it's probably the #1 killer for why we have hair loss.
Okay, so what happens? What do you mean miniaturization? What happens with those hair follicles?
They get smaller and smaller and smaller, and eventually they become what we call vellus. Okay. These are little white wispy hairs, and if they're not addressed medically, they're going to fall out. Okay, those hairs are gone. So DHT, unfortunately, is a major contributor for hair loss for both men and women. Men more than women, because women, hair loss is multifactorial. There's many different things that contribute to why someone develops hair loss. I would almost argue that women there's other things going on, hormonal changes that are contributing to the hair loss as well. But DHT is a major contributor for hair loss. So what you're emphasizing is that the first thing we have to do before we even run to a hair transplant is we have to look at your medical history. We then have to look at the type of hair loss you're experiencing. Because if you go to a hair surgeon and they look at your hair loss, they might say, hey, we're just going to do a transplant. But that's not the best approach, because, and by the way, that shouldn't be the first approach. And that is not our first approach.
Yeah, our philosophy is you need both medical therapy and potentially surgical therapy, meaning hair transplant, in combination. It's not one or the other. And commonly, the medical aspect, medical therapy is key to not only performing a transplant that is going to survive, but also sustaining that transplant over many decades. Okay, so if you, very often we see people who have had transplants and there has been a paucity of discussion about ongoing medical therapy after the transplant, because they've gone to surgeons who just want to operate and are not thinking about long-term maintenance of that hair, or they've gone to a foreign country where they've had a transplant and there's no follow-up in terms of the ongoing medical therapy that's necessary to maintain the hair transplant. Hair loss is inevitable, but
For everyone.
but the thing is, we want to try to maintain those hair follicles as long as possible, and the way to do that is with medical therapy, and that's a component that cannot be ignored.
Now, we made a lot of videos about different medical treatments. We talked about DHT blockers, finasteride, dutasteride, minoxidil, spironolactone. I would encourage you to check those videos out, because primarily what we want to focus on today is who's a great candidate for this procedure. Okay, so we go through the physical, we look at the trichoscopy, we analyze what type of hair loss condition you have. If you do have androgenetic alopecia for both men or women, then you are potentially a good candidate. But the next thing that we have to do is we have to look at the donor supply. And the primary donor supply comes from the back of the scalp, okay?
Because the hair follicles back here are genetically different than the hair follicles up here. That's why people retain a cuff of hair back here. I'm talking about men in particular, retain their hair back here, but they lose the hair in the front.
Okay, and what's important to understand is we have a finite supply of hair back here. So we have to be conservative about what we do. We have to be very safe about what we do.
And strategic.
And we have to be strategic. And we have to look at how aggressive your hair loss is, okay? If you have significant hair loss, then we can't use the entire donor supply back here. If we're just fixing your hairline, if you're a female, we're strengthening your widening part. That's how we kind of approach these hair transplants. We have to look at what we can address right away, and we can't be too aggressive, because you can deplete a significant amount of hair back here, and that can cause complications.
Because there's a finite number of hair follicles that we can transplant to the front. Yes, in men, we can sometimes take hair from a beard area down here and transplant onto the top of the head. But this hair is not the same texture as the fine hair back here. We want to retain as much hair back here as possible so we can go back. Sometimes you require more than one transplant. It's not always a one and done procedure where you do it once and you never have another transplant in your life. Sometimes you have to come back again to supplement ongoing hair loss. And that's why we don't want to, play our hand entirely by using and depleting all the hair follicles that are back in the donor area. So we are conservative about how much hair we take initially. Now, that's also dependent on the age of the patient. So what happens when a patient, say, comes in their 20s and they have a strong family history of hair loss? How do you approach that patient?
Yeah, so I get a lot of questions commonly on Instagram from patients who are in their 20s, believe it or not, and they're curious about having a hair transplant. And the first thing I say to them is, absolutely No. Okay. Now, that's not to say that you can't have a hair transplant in your 20s, but it's very, very unlikely because the first thing that we have to do is address the underlying reason why you're experiencing that hair loss. And it's very, very likely you have to be on some form of medical treatment if you're not. And I would not rush to do a transplant on someone who's under the age of 30.
Right. Well, and if people are in their 20s and they have a strong family history of hair loss, it's likely that they're going to continue to have an aggressive loss of hair. And what could happen is if you take the hair from the donor area and transplant it to the front, some of that hair that's transplanted may be retained, but it may end up to be an island of hair here and loss of hair on the top, which will look very unnatural over time. So you have to be extremely cautious and conservative about how to transplant those individuals who are losing hair in their 20s. So we understand that these are prime years when you want to look your best and you're socially engaged and you want to look sexy. But the problem is that long term, it doesn't portend good things if you take too much hair from the back, transplant it in the front, and end up with abnormal, unusual hair patterns later on.
Now, I'm glad you illustrated that, Dad, because I think, we spend a lot of time when we see these younger patients who come in. We don't think about just what the results are going to be next week. We don't think about what the results are going to be in a year. We're really thinking 10, 15, 20 years. How is their hair loss going to progress? Because that changes our approach to performing hair transplants in younger male candidates, right? So with younger male candidates, we usually are more conservative in terms of how many hair follicles we take, because the last thing we want to do is cause complications, and we do not want bad results.
Right. We want great outcomes. So, and we follow the patients over decades. We're not here to, do the procedure and run out the door. We're here to maintain and be your advocates over a long periods of time. Now, tell me your approach, surgical approach, if you will, of how you would approach somebody who wants a hair transplant, who's a male, say who is about 30 years old, and they want to wear their hair short. What would you do? How do you approach that patient?
Yes, so someone who's in their 30s wears their hair short. The surgical approach is to do an FUE, follicular unit extraction,
which is
where we take individual hair follicles from the back of the scalp. These could be they're follicular units, and these follicular units can have 1 hair, 2 hairs, 3 hairs, or 4 hairs. The reason why FUE is ideal for someone who has short hair is you can wear your hair short and not see anything, like you don't see any visible scars in the back because we're using these really small micro punches. And as long as you're conservative, you're not too aggressive in terms of taking too many hair follicles, it's really, truly I want to call it almost a scarless procedure. It's not completely scarless, but you really can't see that you had a hair transplant.
So what is the alternative to that? What kind of other procedures are there?
So if someone were to come in and have hair similar to mine, I don't have a really short hairstyle. You have a much shorter hairstyle than I do. I would explore doing an FUT, which is a strip technique. We take a small strip at the back of the scalp, we remove that strip, and we zipper it up with sutures, okay? And when you run your hands through the back of your scalp, you really don't appreciate any loss of density. Okay, so and what I like about this strip technique is, number one, I think the grafts are more lush. I think we get less transections because when we perform FUE, we can get transection rates of the hair follicles.
That means that the hair follicle can be cut off in a certain angle.
And then we can't use those follicles. They're gone. So we actually think that we can get more grafts when we perform a case when we do a small strip. Now, strips are not for everyone. It's really based upon the hairstyle that the individual wears. So those are the two approaches that we would take.
On a male.
And the same goes if you're in your 50s and 60s as a male. We would approach you in the same way. We would perform either an FUE or an FUT. Sometimes we combine the two procedures. With older male patients, because your hair has kind of progressed in terms of its hair loss, we can be a
It's
little
stable.
it's more stable. Maybe you've been on medical therapy, but even if you haven't, we kind of know where your hair loss is at. And so we could be a little more aggressive with how many grafts we take. With a female patient, hair loss is different. You know, again, it's multifactorial. It may not only be androgenetic alopecia. There might be a thyroid condition going on, PCOS, a lot of different things happening. But commonly with female patients, we see widening parts or maybe some diffuse hair loss. Sometimes there's some regression of the hairline. And we commonly get asked, what is the best approach to performing hair transplants in these patients? What's your take?
Well, we believe that because women typically wear their hair long, you can easily take a strip out in the back and they won't miss anything and they won't even see anything. So we like the idea that a strip procedure in the back in a woman in particular is an ideal procedure, which we think you get better, healthier grafts ultimately that can be transplanted into the front of the head. But occasionally we do an FUE on women as well. There are small cases where we do FUE on women. If we do an eyebrow transplant, for instance, we might consider using FUE, or maybe we'll do a strip on a small strip as well on a woman who needs an eyebrow transplant. So there are different, I think different decisions that we make.
And I think we tend to lean for female patients for the strip because they have such long hair. You're never going to see this strip. That scar that everyone's afraid about, we avoid that scar because we do a trichophytic closure, and it's imperceptible. We go back to our female patients and our male patients, we can't even find that linear scar. So, but with that said, we do perform FUE, but we don't think it's great for larger cases. We think a strip is going to be more ideal. So those are kind of really the two approaches. And so we're excited this upcoming year to give away 2 free hair transplants. 2. Okay, so if you're interested in getting a hair transplant, if you live in the United States, you would be an ideal candidate. We're looking for people who want to apply. The link will be below. We're going to announce winners in February. So please share this video. And we really wanted to share with you kind of our approach to how one would think about becoming a candidate for a hair transplant, because there's a lot that's involved. It's not just go get the hair transplant. You really have to think about your medical history, your family history. You have to have a proper diagnosis. We have to look at your donor supply. There's a lot of things to think about.
Right. And that's the right way to do it.
Absolutely. So we're going to keep doing these lives. We're going to try to do these maybe weekly or bi-week or every other week. We're going to talk about different topics. But this is really exciting because we're giving away a free hair transplant. So if you have any questions about approaches to hair transplants that we have not addressed, please leave them in the comments below. Please hit that subscribe button so that you can join our community. And as always, we are both here to teach you about hair loss, hair transplants, and plastic surgery.